My name is Dr. Lee Klepper. I'm a gastroenterologist at Atlantic General Hospital. I work as one of the team members along with my partner, Dr. Jonathan Bell. We do colonoscopies among other GI-related procedures, and I'm here to talk about colon cancer awareness. Colonoscopy is probably the best way of evaluating for colon cancer. We also have the ability to evaluate for polyps, which are precancerous lesions that can turn into cancers. A colonoscopy is really good because it's the best way of evaluating the colon for anything abnormal. Not only is it diagnostic, but it's therapeutic. We can remove colon polyps before they turn into cancers, and certainly we can find cancers. If we find cancers, the hope is that we find them early before they've had a chance to spread and when they are still amenable to surgical resection and cure. Colonoscopy should be done in normal individuals, Caucasians at the age of 50. African Americans should actually start colon cancer screening at the age of 45. However, the American Cancer Society is now recommending that all people get colonoscopies starting at the age of 45. Those are normal individuals who have no family risk factors. Now, if you have a family member who's had colon cancer or precancerous polyps, you should actually start getting screening earlier than the age of 50. If you had a family member who had colon cancer in their below the age of 60, you should actually start your screening at the age of 40 or 10 years before that person had their colon cancer. Risk factors for colon cancer are multifocal, there are multiple risk factors. With inflammatory bowel disease have higher risk factors. If you have multiple family members with colon cancer, that's a higher risk factor. It's called Lynch syndrome. If you have Lynch syndrome in the family, then you should probably get colon cancer screening earlier. Lots of red meat is a risk factor for colon cancer. Not eating lots of fruits and vegetables, risk factors. Fatty foods in general are risk factors for colon cancer. Certainly smoking cigarettes is a risk factor for multiple cancers, including colon cancer. Ironically, the earliest sign of colon cancer is no symptom whatsoever. Many people have colon cancer for many years and don't have any symptoms. That's why we recommend screening. But certainly if you have a change in your bowel habits, if you have rectal bleeding, abdominal pain, those are all early signs of colon cancer. It depends. If you have a normal colonoscopy and you have no family risk factors, then you should get a colonoscopy every 10 years. If you had polyps taken out, depending upon the kind of polyp, you can have a follow-up in 3 years or 5 years. And it depends upon how large the polyp was and the pathology of the polyp. So not everybody gets a colonoscopy every 10 years. If you have family members with colon cancers, then you would theoretically get a colonoscopy done once every 5 years. The preps have been reduced in volume over the years. It's no longer that gallon of liquid that you have to drink, and depending upon the type of prep, you may drink 2 5-ounce cups of liquids the day before. You may have 2 16-ounce cups of liquids. Sometimes you have to drink 4 8-ounce cups of liquids. So the whole idea is that they've reduced the volume of the prep. You always have to be on a clear liquid diet the day before the procedure, however.
Understood, but it shouldn't be quite as intimidating for people.
It's not the gallon of liquid that they used to make you drink in the past, and then what they do is they split the prep up so it's easier to do. Colon cancer, it's the second leading cause of deaths in men and women in the United States. It's not the most common cancer, but it's common in men and women. So, probably there are other cancers. I think lung cancer is more common, and certainly in men, prostate cancer is more common, and in women, breast cancer and gynecologic cancers. However, for men and women, it's the second leading cause of cancer death in the United States. The whole idea of prevention is worth a pound of cure. If you can find the cancer earlier, even when you get a screening colonoscopy, if we find it and you have no symptoms or signs, very often we are going to be finding that cancer earlier and you're still curable.
Perfect. So recording. So if you could introduce yourself for the record.
Hi, my name is Stephen Brown. I live in Worcester County.
And you're a lifelong Worcester County resident?
I am. Started with a colonoscopy that actually I'd done 2 years early because I was having some abdominal issues. So I went ahead and did that after 8 years instead of 10. And at that time they discovered what they were telling me, a polyp, and it was a carpet polyp that basically was in a bad location. Carpet polyps, I understand, are like flat carpet, and it was not removable by the standard procedures. So I was referred to University of Maryland in Baltimore, where I was a specialist. Is one of the very few that actually I understand it can remove these carpet polyps without damaging the colon. And after that procedure, which did not work because of the location, I had to have a colon resectioning where they removed a foot of my colon where the bad polyp. Fully recovered. I do again need to, it's been a year, I take another colonoscopy after the first year, and if there's no issues, then I will not need one till at least 3 years after that. So last year there were 3 prep sessions, probably within 3 or 4 months, so once a month. That was the first initial colonoscopy where they discovered the carpet polyp. Things have changed quite a bit in the prepping procedures based on when I first started and when I went to Baltimore and done it. It was very easy. It was some pills. It was very little fluids, and it was, as I understand, just as good as the others.
So it wasn't really too terrible of an experience going through that prep? From the surgery until you were able to get back on the golf course?
That's interesting.
How long were you supposed to wait between the surgery and the golf course?
I'd say within 6 weeks I was back on the golf course. Okay. From removal of a foot of your colon.
Mm-hmm. All right. Well, Mr. Brown, thank you so much for joining us and for telling us your
I'm
story.
Twyla Fikes. I am the nursing supervisor and coordinator for the Worcester County Health Department Colorectal Program. To be eligible for our program here at Worcester County Health Department, you need to live in Worcester County. You need to be 50 years of age or older. We can see younger if they have symptoms or if they have a family history of colon cancer. You have to be within a certain income. You do not have to have insurance, or if you do have insurance with a high deductible, we can help. If you have insurance and it pays for the entire colonoscopy but just needs assistance with making appointments and navigating through the system, we can also help with that. So for more information, please give me a call at 410-632-0056. Thank you.